the next scenario, scenario number 5. What CPT code and ICD-10-CM codes are reported? Options are option A 27832 RT. ICD codes are same for all the options as 82.391A, W19.XXXA. Option B 27827 RT. Option C 27829 RT. Option D 27826 RT. Preoperative diagnosis right angle triplane fracture. Post-operative diagnosis right triplane ankle fracture, right angle triplane fracture. Procedure open reduction and internal fixation of right ankle triplane fracture. General anesthesia, endotracheal anesthesia, complication none, specimen none, implants used, synthesis 4.0 mm, cannulator screw, procedure in details, patient was brought back to the operating room and placed in on an operating table, given general anesthesia without any complication, and given preoperative antibiotics used per usual routine. He had right lower extremity prep and draped in a usual sterile fashion, with alcohol prep followed by routine betadine prep. Under X-ray guidance, a pointed reduction clamp was placed from anterolateral corner of the distal tibia to the medial side, and I reduced the triplane fracture. It was confirmed on both AP and lateral X-ray image. The gap was reduced. The patient then had a guide vest taken from the joint to catch from the synthesis 4.0 mm cannulator screw set. Once one was placed medially along the epiphysis on the anterior half of the epiphysis and parallel to the joint to catch the lateral aspect of epiphysis. One screw was placed above the physis from the anterior to the posterior to capture that spike. Once the wires were appropriate precision, the length was measured and partially threaded. 4.0 mm canalculus screws were then selected to all threads were across the fracture site. The appropriate length screws were placed, confirmed by an X-ray to be in good position. The fracture was anatomically reduced and the angle joint was anatomic. The patient had wounds copiously irrigated. Closure was done with interrupted horizontal mattress 3-0 nylon suture. The patient had a sterile compressive dressing applied, was placed into three-sided posterior mold splint, was extubated and brought to the recovery room in a stable condition. There were no complications. There was no specimen, sponge, and needle counts were equal at the end of case. What CPT and ICD-10-CM codes are reported? And coders, your 2.5 minutes starts now. Okay, Coda. So I thought like I will give you a couple of more minutes for this scenario. It's a close call, right? It's a close call. Might be between option B and option D. Okay, I am looking at your chats. Okay, let me walk you through this one. This is going to be a good scenario. The correct answer, I did accidentally reveal the answers, by the way. Not sure how many of you noticed that. Okay, my on clicks were off for this one. So the correct answer is going to be option B. And we have a right angle triplane fracture, open reduction and internal fixation, or if right angle triplane fracture performed, general anesthesia was given, reduction clamp was placed from the anterior lateral corner of the distal tibia to the medial side. Reduction of the triplane fracture performed, guide wires used, epiphysis on the anterior half of the epiphysis, parallel catch. The lateral aspect of the epiphysis screws was placed above the physis, length screws were placed, confirmed on by X-ray. The fracture was anatomically reduced and the ankle joints were anatomic. So that's all the procedure performed. There was a reduction of an triplane ankle fracture. The procedure inventory, we have open reduction and internal fixation of right ankle triplane fracture. Diagnosis inventory, we have right ankle triplane fracture. So this is an image of a triplane fracture. So basically the triplane fracture, it means that it involves three different planes. So as you can see in the image as well, they involve three planes. So that's why it got the name triplane fracture. And for our scenario, it happened in the ankle. So you can see it near the distal tibia and the fibula. So it has a distal, I think it was near the distal tibia. Okay, so we had an ankle triplane fracture in our scenario. So let me go back to the coding portion and let me solve this let me first eliminate the wrong options. We have 27832, which is coding for open treatment of proximal tibiofibular joint dislocation. Cross-checking with the procedure inventory, we didn't had any dislocation. Instead, we had an ankle triplane fracture. So we are not coding for a dislocation here. Straight away, option B is incorrect. Option C is coding for 27829, which is once again for a open treatment of distal tibiofibular joint disruption. And again, we are looking at a fracture treatment and not something which is related to a disruption. So option C is also incorrect. So the $1,000,000 question between option and option D, how did I select option B as the correct answer? So once again, I would like everyone to join me in the chat and let me know, Chorus, how did you know that option B is the correct one? How did you select? Those who selected option B as the correct one, please let me know. Why do you think option B is the correct? Mm-hmm. Okay. Okay. Good observations. So the sorry. So the difference between option B and option D is that in option D, it is coding for a procedure or reduction procedure in which the provider will surgically fix the fracture of the weight bearing articular surface or the portion of the distal tibia by securing the tibia with the plates, right? With the plates and the screw. And in, I'm sorry, with the fibula with the plates and the screw. And while in option C 27826, you can see 27826 is only using the fibula, while in 27827 it involves a provider will surgically fix a fracture of a weight-bearing articular surface or a portion of the distal tibia by securing the with with the screws, plates, wires, and the pins. So in our procedure, if we carefully look at this term, someone has said, yeah, it's only talking about the tibia, not the fibula. Yes, correct. So you can see over here as well. Under the X-ray guidance, a pointed reduction clamp was placed from the anterior corner of the distal tibia. So as I previously said, it was a distal tibia to which the plates or screws or the clamps in this case has been attached to treat the reaction. So it involves a distal tibia only and not the fibula. And that is the reason why option B 27827 is the correct one. As you have said, there is no fibula involvement here. Is that clear, Coder? Okay, okay, okay. I can see only a couple of answers. How about remaining? How about rest of you all? Is explanation good? Shall I move on to the next question? Again, one more scenario. This one is all about having a forensic look into the procedure note. Yeah, great. Okay, so I can see you have said, okay, let's move on to the next chapter. Yeah, we are done with musculoskeletal as well. Now let's move on to the respiratory system. And here you go. Here's your first scenario from the respiratory system chapter. And what CPT and ICD-10 CM codes are reported? Option A 32601, 32666, 59 modifier, S27.0XXA, V03.90XA. Option B 32666, LT. Option C 32666, LT 31622 with a 59 modifier. Option D 3165615, LT 31622 with a 59 modifier. Preoperative diagnosis pedestrian in MVA involving a car left pneumothorax. Postoperative diagnosis the same procedure, bronchoscopy, left VATS, which resection, which is video assisted thoracoscopic surgery. The procedure, patient was brought into the operating room and placed in supine position. IV sedation and general anesthesia was administered per anesthesia department. A single lumen endotracheal tube was placed for bronchoscopy per anesthesia. Due to the nature of the trauma, we were interested in ruling out a bronchial tear. The bronchoscope was introduced into the mouth and passed into the throat without difficulty. There was no sanguineous drainage or bronchial trauma noted to the left mainstem. There were copious amount of secretion noted and removed without difficulty. The right main stem was also cannulated and found to be free of unexpected trauma. The bronchoscopy was terminated at that time. A double lumen tracheal tube was placed for anesthesia. Position was confirmed by bronchoscopy. The patient was placed in a decubitus position with left side up. The chest was prepped and standard fashion with a betadine, sterile towel, sheets, and drapes. A small incision was made along the upper border of the fourth rib just below the intercostal space, and a standard port placement was utilized to gain access to the thoracic cavity. An endoscope was inserted into the chest cavity. Initially, we had excellent exposure with good isolation of the lung. We identified large bleb at the apex of the lower lobe of the left lung, which was likely to be the source of chronic air leak. We removed the area of the large bleb At the apex were the wedge resection using a thoracoscopic green load for therapeutic correction of the patient's pneumothorax. The wounds were closed in layers, chest tubes were placed, patient tolerated the procedure well, and was taken to the recovery room. What CPT and ICD-10 CM codes are reported for the scenario? And coders, your time starts now. Okay, coders, I was looking into the chat. Good answers. So we have a pedestrian in MVA involving a car, left pneumothorax, bronchoscopy, and left VATS wedge resection performed. Patient was placed in supine position. IV sedation, general anesthesia given. Bronchoscope was introduced. Found to be free from unexpected trauma. Patient was then placed in a decubitus position. A small incision was placed, fourth rib just below the intercostal space. Endoscope was inserted to the chest cavity. A large bleb at the apex of the left lower lobe was found, and and we removed the area of large bleb with wedge resection using a thoracoscopic green load. So the correct answer for this scenario is going to be option C. And in procedure inventory, we have a bronchoscopy and left VATS wedge resection. Diagnosis inventory, we have a left pneumothorax and a pedestrian in MVA. So you all know that lungs have, we have two lungs, right lungs and left lungs, and one of it have three lobes and the other one has two lobes. And here in this scenario, the left lung had a collapse, or other words, we can say that patient was having a bleb through which the air was leaking, and patient had the condition known as a pneumothorax. So what's a pneumothorax? Pneumothorax is an abnormal collection of the air in the pleural space between the lung and the chest wall. So because of that air leak and the bleb, there was a collection of air between the lung and the chest wall, as you can see. So patient had a collapsed lung in our scenario. And what did the surgeon do, or what did the physician do to treat the scenario? He first performed a bronchoscopy, a diagnostic bronchoscopy, to check if there is any unexpected trauma. And this is how a bronchoscopy, you can see the image in the screen. This is how a bronchoscopy procedure is performed, and followed by he did a surgical procedure as well, which is uh sorry, which is a video assisted thoracoscopic surgery, where you can see multiple incisions are made between the ribs. Through one of the incision, he will use a camera in order to see what's happening inside, and through other incisions he can insert the surgical equipments such as scissors, the clamps, etc. And then he will do the procedure, and the procedure which is performed here is wedge resection. So we had a video assisted thoracoscopic wedge resection also performed in the scenario. So I hope the procedure which is performed is clear for all. Now let's move on to the coding part. So we have to select the code that best matches our inventory, and 32601 is coding for thoracoscopic diagnostic procedure. We didn't have a diagnostic thoracoscopy procedure performed here. We had bronchoscopy followed by video assisted thoracoscopic surgery. Option D is coding for 31615, which is again for a tracheal bronchoscopy through established tracheostomy incision. And we didn't had any established tracheostomy incision also in the scenario. So option D is also incorrect. And now between option B and option C, option B is only coding for 32666, which is for a thoracoscopic surgical with therapeutic wedge resection, initial unilateral. Yes, that is the correct answer, but option B is incorrect because that is also not coding for uh, another this first procedure, which is a bronchoscopy performed. And option C coding for 32666 LT and 31622. So 31622 is for a bronchoscopy, rigid or flexible, including fluoroscopy guidance when performed, diagnostic with cell washing when performed, and that was the first initial procedure performed. How are you feeling, coders? Please let me know in the chat. Great. So there are two procedure codes to report in this case because two distinct surgical procedures were performed. As we know, there were two different scopes used as well, right? That's why we appended a 59 modifier. The first procedure was a surgical thoracoscopy to remove the wedge of the left lung through an endoscope. Second was a diagnostic bronchoscopy. So two different procedure and two different approaches were used, and that's how we used a 59 modifier.
Thanks for tuning in, and until next time, happy coding!